Hi, Dr. Saxena here, and let's talk something of very common thing called hypertension, and what are the dietary approaches we try to work on when dealing with this thing called hypertension. As I say this particular stuff, I just need to tell you, I normally this is one of the big things. It is called DASH diet. It is a dietary approach to stop hypertension, and it has got high in fruits, vegetables, nuts, whole grains, fish, poultry, as well as low-fat dairy products. Red meat is not included here. It's obviously low in red meat, and it is the most significant part of this diet is low sugar, no white sugar here, low fat, low cholesterol. So this DASH diet lowers blood pressure more than the sodium restriction alone. The moment someone gets diagnosed with hypertension, the first thing we talk is that reduce the salt. Yes, definitely salt recommendation has to be done. The salt should be somewhere the guidelines are like this. We believe the salt should be less than 1500 mg per day. It comes to roughly 2/3 teaspoon of its salt. That is the only thing which is required for the whole day. And I can always tell you there are a lot of fruits and all that, there are a lot of your grains which also contain salt, so you don't have to worry about that. The previous recommendation was less than 2400 milligrams, which was 1 teaspoon per day, and this one is now it has reduced to 2/3 of a spoon. This is something like 1500 milligrams. So what is the potassium recommendation? Potassium recommendation is something like 4,700 milligrams per day. It is whatever I'm giving you is this from these papers. See, the ratio of sodium and potassium may be more important in causing the hypertension than the level of sodium alone. So you need to understand there's a balance between sodium and potassium. So you have some high potassium containing fruits which you should know. One thing is spinach, which is your palak ki bhaji. Another one, all the dark leaf vegetables has got high potassium. You have fruits like bananas or oranges. You have tomatoes. You have dry fruits like almonds. You have got even your potato. When I'm talking, this is a very staple thing. Potatoes and beans, they have a very good amount of potassium, and there are some dairy products which also have this high levels of potassium. So the first guideline of this DASH, and we try to tell the first thing is that I try to maintain good balance between sodium and potassium. The next thing I try to, from my side, I try to jump into something called coenzyme Q10. And mind you, when I'm talking about coenzyme Q10, there are a lot of things which are depleting your coenzyme Q10 levels. The first thing, the person who is a hypertensive, tries to control hypertension and all that, he's being prescribed with something like statin drugs, which reduces your coenzyme Q10. You have apart from that, there are some vitamins, there are some bile acid sequestrants which reduce your coenzyme Q10. Coenzyme Q10 is we found it's a general thing. It is globally decreased in people who has got ischemic heart disease, and coenzyme Q10 concentrations in that progressively decline in the blood as well as myocardial tissue with the increasing severity of the heart disease. It was one of the studies which showed CoQ10 levels were low in 75% of the patients who are undergoing cardiac surgery. This was so addition of coenzyme Q10 helps in tremendously, particularly if you are having some congestive heart failure, you have got some angina, you have got some hypertension, arrhythmias and all that. CoQ10 will improve your kind of tolerance level. It will help you not getting into these are the things which I believe, and there are some peer-reviewed things. Taking coenzyme Q10 will prevent you from getting into cancer, diabetes, cardiovascular disease, and muscular diseases. So it's a big because coenzyme Q10 is one of the powerful antioxidant. and it is something which I believe everyone has to take in a once you have some effects of some hypertension or something like that. You should always. So this is my thing in coenzyme Q10. The thing next thing I try to work it out when it apart from the diet, we have started with coenzyme Q10. We try to work with something like carnitine, L-carnitine. L-carnitine has got a synergistic relationship with coenzyme Q10, and its primary function is oxidation of long-chain fatty acids, and it is shown to reduce the blood pressure and attenuate the inflammatory process associated with arterial hypertension. Okay, so this is the thing which might produce a primary inactivation of renin-angiotensin system, resulting in reduction in production of angiotensin 2. This is a dietary supplement which is sold as a kind of thing. You don't require a prescription medication for this. So effectively what we are trying to work with any case of hypertension, and this is like you are trying to reduce the free radicals by taking a lot of these fruits, trying to work with coenzyme Q10 and this L-carnitine. This what happens is that once this free radicals, the more the free radicals you have, it promotes more platelet aggregation. It injures endothelium, and it promotes monocyte macrophage chemotaxis, and it enhances intravascular coagulation. So you need to be careful with free radicals, because free radicals are abundant in the things what we are subjected to. In the sense we are living in this, I say it's a toxic world, and I don't have to smoke 20 to 40 cigarettes per day to produce that free radicals, because whatever I'm ingesting through air, food and water are really they are increasing your free radical formation exponentially. We still believe that okay, maybe I might be having. I can always challenge anyone. If we can always do some kind of test and all that, I can always show you the free radical activity in your body at the present time is quite high when it compared to decades back. And this is the free radical activity. I always tell everyone to look into that. And so how does it manifest? It manifests as diseases, in the sense you start hypertension, you start into getting into some cholesterol, abnormal cholesterols. So these are all the simple you get that peaks, and you have the main problem is the free radicals. So you just try to control the peaks. It is not enough. You need to work to quench what is the free radical activity. Ongoing free radical activity has to be quenched. It has to be decreased. So with this thing, I just thought let me share this particular thing to you. And somewhere I was working with a patient, and it is not a simple approach. This is we try to work on free radical activity by working on something, because free radical activity is directly proportional to the kind of toxins you have got. Toxins, namely, I try to tell you some metallic toxins, you have got some organic things, you have some bisphenols. So all these things constitute that increase in free radical activity. The moment I reduce this kind of free radical activity by taking out a lot of toxins and this heavy metals, bisphenols, you try to work out with all these solvents, the moment we start reducing that, things, the free radical activity comes down. So what is the major thing is, you need to work out at the denominator level. I'm not only trying to put your cholesterol in the normal thing or into hypertension into normal thing and tell okay you're fine, you go. It's not like that. You need to work on the basics. So this is the kind of integrative protocol when we are dealing with any kind of patient who comes with these labels. Thank you.